Yes, we're live and all is set up. So Professor Antoine Flahault, thank you very much for joining us. And I would like to begin with the opportunity of presenting yourself, because I think, well, you're a famous professor from the University of Geneva. You have been one of the first to introduce the concept of no COVID, or at least to talk about it in Switzerland. So we are very interested in hearing your opinion on various issues, and I would like to give the opportunity to present yourself a bit more.
Yes, thank you, Roman. I'm very happy to participate in this discussion, in this conversation. I am Antoine Flahault, and I am a professor at the University of Geneva. I am a medical epidemiologist, so a doctor initially, and also with a PhD in biomathematics. So my field is theoretical epidemiology, which is the mathematical modeling of communicable disease. And I spent most of my research activities on emerging infectious disease. I worked previously on influenza, on chikungunya, on SARS, SARS-CoV-1, and of course nowadays I'm working with the SARS-CoV-2, particularly with the two engineering schools, ETH Zurich and Lausanne, where we produce every day a dashboard with daily epidemic forecasting. We refrain ourselves to predict beyond 7 days, but for the 209 countries in the world, of course, including each canton in Switzerland, we produce this epidemic forecasting. It's completely open. You can just type daily epidemic forecasting and coronavirus, and you will find it.
Thank you very much. So I would like to begin with some more scientific questions, then shifting a little bit to scientific political question, and then talk about more also personal questions, your opinion as a human being. And yes, so my first question is basically the coronavirus. What in your view, I mean, we have all got a better grasp of it now over a year, yet what is in your view making that special?
It's a good question, because I think most Western politicians and experts felt that this was a new pandemic influenza-like event, which is absolutely not. It's not a pandemic influenza. And probably, I mentioned that my background is mathematical modeling and theoretical epidemiology. And in theoretical epidemiology, we can see easily that this coronavirus has an over-dispersion characteristic. Over-dispersion means that 80 to maybe 90% of the contaminated people will not contaminated more than one person, and they will not contribute at all in the epidemic dynamic. So we have to concentrate on these super spreaders who are contaminating much more than one person, sometimes 2, 3, but sometimes 20 or 25 or more. And these are the engine which fuel the process of the dynamic of this epidemic. And it's completely different from a regular classical influenza pandemic.
Mm-hmm. And I would like to ask you a question about the virus that is basically just concerning the virus, yet it has huge political implications later on, potentially. So, I mean, we have been living with influenza for decades, centuries maybe. So when you're talking about the possibility of even going to something like elimination, like they have in New Zealand, do you see some intrinsic differences in the virus between coronavirus and like influenza virus that could make that even a possibility that we might not have to live with coronavirus after all, while we might have to continue living with influenza?
Yes, that is, I think, the way to see and to think this no COVID approach, this elimination strategy. it is clear that there are different choices, different options when dealing with a pandemic. If you deal with a pandemic like influenza, you are totally right to say that we probably can live with influenza. And even if we would like to eradicate influenza, and nobody never tried to eradicate influenza, you would not succeed because there is an animal reservoir of influenza viruses which is birds, chicken, and also pork, pigs. And because of that, you will have always swine flu or avian influenza coming into the humanity with new strains, new viruses. You will never succeed to eradicate these viruses, which are really very dominant in many species, not only mammals, but also, as I said, birds. So we cannot really eradicate influenza, and we have to live with influenza. But fortunately, influenza, first of all, doesn't have such high reproductive rate as the coronavirus. The coronavirus has a reproductive rate of around 3, between 2.5 and 3, and maybe above 3 with the new variants. The reproductive rate, is the number of cases you contaminate when you are yourself contaminated. But again, just remember that it is not a constant. It's a variable with a skewed distribution, meaning that 90% as 1 or 0 secondary contaminated people, and the others are going to the right. So clearly, influenza has no over-dispersion. Influenza has a low, relatively low reproductive rate, and so it's not a disease which overwhelms the healthcare system to the same extent as the COVID and before the SARS did. We do not have long-lasting overwhelming of intensive care units with influenza. We do have a form of overwhelming, and due to that, sometimes we need to take some urgent actions to limit this overwhelming. This is the mitigation attitude, strategy we decide with influenza. When we decide that with COVID, what we can see is a kind of stop and go, which continuously overwhelm the healthcare system, and particularly the intensive care units, and you cannot live with these coronaviruses. We try to in Western countries, but with failure at each level, at the health level, we succeed to avoid this overwhelming in a way, but at a high cost. We have to lock down our countries, and it is repeated and repeated with waves which come back, and we are not sure that we will be able to succeed even with herd immunity to slow the process. So living with is something which is possible with influenza, and which seems to be highly difficult with this coronavirus.
Mm-hmm. And apart from the reservoir which you mentioned, are there also other differences in coronavirus compared to influenza virus that might increase the chances that with one vaccination we might be able to go towards elimination? I mean, influenza is something where we have to get the vaccination every year. Is there a chance that it might be different for coronavirus?
That is still a pending question. In a way, what we know, we do not have many diseases we have succeeded to eradicate to date. So it is quite challenging to think about eradication. Usually we reserve the term eradication to the elimination at the global level. When there is no more virus on the planet, we can say it is eradicated. And to my knowledge, to date, only smallpox has been eradicated among the human viruses. Poliomyelitis is really on the process of eradication, but it is still not completely eradicated. 40 years ago, in the 80s, 120 countries in the world did experience some cases of poliomyelitis, with probably more than 300,000 cases of paralysis in children each year. Today, there is a couple of paralyses reported by only 2 countries. So it's quite a success, and probably it will be eradicated, but it is still not. Measles was planned to be eradicated, and it has been eliminated from the Americas, both South and North Americas and Central. But recently, the virus came back, and it seems to be very difficult to eradicate because of vaccine hesitancy, something we may also meet with this coronavirus. The SARS has been eradicated from the planet, from the humanity at least, because after 2003, we did not see any human bearing the virus anymore. So we don't know exactly why. It has not been eradicated thanks to a vaccine. It has been almost spontaneously eradicated. Of course, thanks to the global coordinations to fight against the virus. The virus was very noisy, meaning it triggered some very severe pneumonia. And at each time you had someone experiencing the infection, he had to go to the hospital for treatment. It was very severe cases for all of them, no asymptomatic cases. For this SARS-CoV-2, for COVID-19, we have some key elements which may allow thinking about eradication. First of all, there is a kind of eradication without any vaccine, which has been successfully conducted by a couple of countries. We may talk about them later on. Second, we have a vaccine which is almost 100% effective. It's not a one-dose vaccine except for Johnson & Johnson. So smallpox had an excellent vaccine, very, very effective, only 1 dose, and it was for life. But it was not so safe. It killed 1 person every 1 million doses injection. So in a way, we have probably safer vaccine with SARS-CoV-2. We do not have animal reservoir. Of course, there are some amplifier hosts which may host the virus, like minks or dogs and probably some domestic animals, but they are not reservoirs in the real meaning of what a reservoir is. So there is no known reservoir to the time being with regard with SARS-CoV-2, which is a good news. Hopefully, we will not discover any, because when you have a reservoir, which is a dormant reservoir, which does not kill, the virus does not kill these animals, but just is hosted by the animal for, yes, at a chronic stage, they may trigger new epidemics in humans you really hardly be able to control. There is not this problem for the moment. And I think if we succeed to vaccine the whole community, as it has been done in Israel, we may dream about an eradication of the virus. It has to be proven. It may be tried in a couple of places before. It has to be planned, organized, funded, and probably also it has to be planned to produce enough vaccines for the whole world population. What you asked is a second part of the question, which is about the repetition of the injections due to variants or due to new strains, it has to be planned and scheduled. But for the moment, there is no need for that, because for the moment, all the variants seems to be sensitive to vaccine, if I can say that, meaning that the vaccines are effective against any variants, even if the effectiveness is a bit lower, maybe with some variants.
My understanding of no COVID is that it doesn't even need to reach the eradication stage. It also means that it makes a lot of sense to go to 0 case numbers per day, meaning that if somewhere another new case shows up, it can be rapidly controlled and put under control. Is that also your understanding of no COVID, or what you understand with no COVID?
For me, no COVID is an eradication strategy. Of course, you're completely right. Eradication may take time. It may be difficult, as we have said, and it will need the vaccine. But elimination is the first step of this no COVID strategy, which is completely successful in Australia, New Zealand, Taiwan, or China. And as you mentioned, they may experience a couple of cases each day, usually coming from abroad, with no circulation of the virus in the community, with all the chains of transmissions which are discovered, identified, and fight. So this is something which is, of course, time-consuming, which does not impair a lot social life and economic life, except for the border controls, which are very strict. But this is something which, for me, it's a kind of intermediate step before a complete eradication of the virus from the planet. So if we think about elimination in our countries, in Europe, for instance, we do need to think about eradication at a global level, because the Director General of WHO often says you cannot dream about safety, a safe place, if the whole planet is not safe. And I think it's completely reasonable to say that.
Mm-hmm. Now let's turn a bit more how we might get there from your understanding of how this virus behaves and the measures we have available of interrupting transmission chains. What do you think would be the most important additional transmission that is occurring at the moment, which is important to interrupt? Is it more people who are not even who are not taking care of safety measures, or is it that some people can simply not avoid coming into contact with the virus because currently we don't have sufficient safety measures in place? What is your view? What would be the most important additional infection chains, infection ways that we need to interrupt?
My thinking is the most simple answer to your question is ventilation. I think the aerosol route of transmission is the main route of transmission, if not the only one. Probably there are some anecdotal other routes of transmissions, probably because the virus may survive on surfaces. You may be contaminated by a surface, but most probably it does not appear frequently. The direct transmission ballistic route, if I can name it like that, is hard to understand on a practical way, meaning that you need to be face to face with one people infected in front of you with no masks, no glasses, and very close enough to infect the nostrils, the eyes, the mouth. This is very small targets not easy to contaminate. So most probably aerosols are the main route of transmission. And aerosols are mainly transmitted in indoors, poorly ventilated rooms, not outdoors, or again, with a very, very low probability of being infected outdoors. So these aerosols contaminated with coronaviruses, which are our respiratory droplets, micro droplets, are most probably the main issue for this pandemic. And when you are in a closed, poorly ventilated rooms with other people and without any mask, you are at high risk of being contaminated if you spend sufficient amount of time in this room. So the main goal today, if we want to reduce transmission, is ventilation which is checked, because you never know in any room you are what is the quality of the ventilation. It's very difficult to know. It's even a real expertise to tell you if your ventilation is enough effective to renew the air a couple of times per hour. Of course, if you are in a speed train or in an airplane, you probably benefit from a very good ventilation. But in other places, it's difficult. So you may implement some CO2 sensors to check the quality of the ventilation. And if the quality is here, you probably reduce a lot the risk of transmission. So that is my thinking of what we can do more to avoid transmission. Of course, there are some hotspots of transmissions, which are probably bars, restaurants, indoors, where, because you are obliged to put out your mask and for eating, for drinking, for speaking, and this is the kind of places which may be at higher risk. And with lifting the measures, the lockdown measures, the risk is that if the virus circulates at a high pace, the risk is to trigger some new chains of super spreading events.
Thank you very much for these insights. Now, if we turn a bit more to the political questions, the Federal Council currently has sent to consultation to the cantons a document in which he envisages that it would be okay if the cases just don't increase too much, and once the persons most at risk have been vaccinated, he would envisage that everyone gets infected. This would be the vision of the Federal Council to get this pandemic then through this pandemic. What is your opinion on that?
You mean to reach herd immunity through infections?
Yeah, I understand that the Federal Council intends to reach herd immunity through infections of the part of the population which will not be vaccinated at some point.
Eligible for vaccination. You know, I'm not aware of any disease which have reached herd immunity through natural infection. For influenza, it never happens. For smallpox, it reached the herd immunity because it was eradicated, but that was thanks to the vaccine, not to the contaminations. And with poliomyelitis also, it's thanks to the vaccine. Each time you reduce the vaccine coverage, you have new epidemics. For measles, as I told you, there was a plan for eradication, which was entirely based on vaccination because the immunity, the natural immunity, was not enough. So I am a bit skeptical on the fact that we can use the natural immunity to help elimination from the country. It's not completely unbelievable. If we, for instance, if we test antibodies of people before vaccinating, to avoid vaccinating with 2 doses those who have already recovered from the COVID, it could be quite intelligent. It may save doses and increase the pace of the vaccination, but it is not planned as such in any countries to my knowledge. Just for the sake of simplicity, we vaccinate people. And if they say, I have recovered and I know I don't need any antibodies, I know my PCR was positive, we can give only 1 dose. We do that in Switzerland, and that's okay. So it helps a bit vaccinating more. But for the others, I'm not sure it's quite a strategy to think that herd immunity will help a lot in the vaccination strategy. I think what is very important is to vaccinate a very, very large segment of the population as soon as possible.
Mm-hmm. If the Federal Council came to you and asked and told you, we want to save as many lives as possible, what would be your recommendation how to proceed?
My recommendation would be definitely, without any doubt, without any hesitation, to change the current strategy to a suppression, an aggressive suppression strategy with a goal of zero COVID, of no COVID, of eradication. And I would suggest that nowadays we decide by changing our strategy to keep the level of the circulation of the virus as low as possible. And each time it bursts in any place in Switzerland, we decide cordon sanitaire, local lockdowns to really stop this local outbreak to spread elsewhere in the cantons or in the country. So moving from something which was a Western classical European mitigation strategy, which failed to be performant, to something which is much more performant with or without vaccine, it has been proved as the most performant strategies, which are first, because of a pragmatic view, the suppression strategy, the same, similar as in Norway, in Finland, in Japan, in South Korea, but with an ultimate goal of a zero COVID strategy like in Australia and in New Zealand. Of course, the Federal Council will probably told me, we are not an island in the middle of the ocean. We are not Iceland, we are not New Zealand. How can you do that in Switzerland, where we have these neighboring countries we are counting on just for running our hospitals in Geneva, in Basel, or in Ticino? Of course, it's not wrong. I would say maybe in your bilateral discussions with the European Union, you could suggest to discuss at the Schengen level how to proceed with this question, because what we need is that the all European countries move from this old failing mitigation strategy to the new successful zero COVID strategies. And I would say also to the Federal Council that most probably the UK, Portugal, Finland, Norway, Denmark are moving already to this zero COVID strategy.
Yes, and we were even close there already once, like 1 year ago, right? Cases were very low, and yet we didn't go the full distance towards zero then. What do you think went wrong 1 year ago?
It's again a good question. Frankly, I was not convinced by the zero COVID strategy 1 year ago, unfortunately. There were not a lot of experts in the Western world advising their government to move to a zero COVID strategy at that time, or even to a suppression strategy. We were just living with a very low tide, with a very low circulation of the virus, and many of us thought it will not come back, or it will be like influenza. So we did not learn the good lessons, most of us, from the first wave. When in Australia, the Prime Minister, she said it was not influenza. We discovered that it was not influenza. We cannot live with this coronavirus. We want to change our strategy and to move to a zero COVID strategy. She said that explicitly, probably thanks to very smart experts around her. We did not say that in Switzerland at the task force at that time. We did not say that in any of the task force scientific council, to my knowledge, in Europe at that time. So I moved to thinking about the zero COVID strategy when I wrote a book in August, in July and August, which has been published recently in a French editor. And when I studied carefully the various options and the various strategies which were taken by different countries, and when I saw it was striking evidence that we were failing and they were successful. And so I changed my mind at that time.
It's important also to be able to change the mind, and I think it's really important to hear this story. Thank you for that. Now, I asked the question, what is your recommendation if you want to save as many lives as possible? Now, the other question might be, well, we also want to have economic freedoms. People want to go to enjoy cultural life. If the Federal Council said we want to have as quickly as possible again all our economic freedoms, what would be your recommendation then?
Yes, that is important because, of course, I'm an expert of COVID now, and I mean I'm a medical expert, so I see all the recommendations, the interventions, COVID-oriented, COVID-centered. It's very dangerous because we can suffer from other diseases than COVID, and there are not only the health sector in the life. As you mentioned, there is a cultural sector, the educational sector, the social sector, sports, many other aspects of our daily lives. So it's good to protect the society against death of COVID, of course, and about suffering from COVID. But we also have to consider this other aspect. And what is also very interesting to see is that those countries which have chosen the suppression or the zero COVID strategies benefit from a much better quality of life, much better freedom of lives, in their social lives, and much better performance in terms of economic indicators. It's completely striking to see that Taiwan, China, Vietnam, which are all in zero COVID strategies, have very, very low rates of mortality, below 1 per 100,000 population from the beginning of the pandemic, cumulative data. But also they have locked down very short period of time, localized for China near Wuhan and Hubei, and almost no lockdown in Taiwan or in Vietnam. And they have a positive change, positive evolution of their GDP in 2020 comparisons to 2019, where all of us are declining. And yes, Vietnam has also created an airline company in that time when Lufthansa is almost in bankrupt. It's another planet. And if you take those countries which are in suppression strategy, they benefit from much better economic indicators than us. Japan is negative in 2020, but much better shape than any European countries. Switzerland is not so bad. And for that, I would congratulate the councillors, because at least Switzerland escaped from a deep recession in 2020. And maybe because of homework was more fitted with the Swiss economy, I don't know exactly, but at least the Swiss measures were less impactful than in France, Germany, or Italy.
Are you saying that if the Federal Council asks you what is the quickest way to recover economic freedoms, maybe it can be the same answer as to the question, what is the best way to save as many lives as possible? It
is. Fortunately, I would say there is no conflict at all between the economic sectors and the health sector. What is good for your health will be good for your economy. So if you live in a very stable epidemiological situations with no COVID, you will recover much quicker for your economy and your social lives. Definitely, without any doubt and without any exception, to my knowledge.
Mm-hmm. Well, it sounds all highly convincing. So my question is, has the Federal Council given you the opportunity to talk about to them in this way?
No, unfortunately not. And I would say that most politicians find these questions around the strategy very difficult to deal with. In many countries, there is not a lot of debate, of democratic debate regarding this topic. I know that in France, the Senate will trigger a debate on zero COVID strategy. So it comes now, but it's very recent, mostly because these questions are very difficult to master, to understand sufficiently well, to have a strong position, strong opposition, a strong idea is something which probably needs some competencies, some skills in epidemiology, in theoretical epidemiology, in virology, in immunology, in economics, in cultural and social lives, which is not easy to master. And of course, that is a duty of the scientific task force, but we are often seen as one aspect of the problem without considering the others. So there are other sectors, I can easily understand that, but sometimes we are a bit orphan when we talk about these topics, because many politicians do not really understand and master these topics.
Mm-hmm. If you go to the outlook, we have now cases stable or even slightly decreasing in Switzerland. So is there reason for hope, in the sense that I remember a graph that you posted on Twitter, which was highly interesting, that showed the differences in R values, and what was striking to me was how little basically changes in R value can make a huge difference. So if it's a little bit above 1, huge problem. If it's a little bit below 1, very good. So is this also reason for hope, in the sense that if we just manage to increase or decrease the R value by 10-20%, we might be all fine towards reducing cases more and more? Or is your view rather pessimistic on our current situation now?
No, my view is not pessimistic at all regarding the Swiss situation. I think that the Swiss situation is a bit paradoxical because we benefit from a very low mortality. We cannot only rely on the reproductive rate, but the mortality level is very low in Switzerland, with something which is around 5 deaths per day, which is among the best situation in Europe currently. I'm not saying that the mortality has always been very low. It has been very high, but today it is very well controlled. The paradox is that the level of contamination is not as low as, for example, in the United Kingdom. We have a situation which is almost similar as in Denmark, which is good also. So we can say that we have a fairly good situation, but the level of contamination is a bit worrying. We need to tackle that, and we need to make pressure to really slow down the level of contamination. And following the reproductive rate is of course good, because if the reproductive rate is below 1, you will slow down this curve, these epidemic curves of the new contaminations per day. But for the moment, these new contaminations are too high.
Thank you very much. We have reached the end of our interview. Thank you very much. You have 1 minute maybe for any concluding remarks that you would like to add. From my side, thank you a lot for joining us. It was great, many interesting insight, and thank you very much for that.
Yes, thank you very much, Roman, for this conversation. I think it is very useful to trigger such debate in the country. I think people need to understand the various aspects of these strategies and the choices and the options, and after they will decide. In Switzerland, there is a culture of democracy, of participating democracy, and I was very, very happy to contribute to this debate to this extent. Thank you.
Thank you very much.
Again.
Have a good
Bye.
evening and good time. Thank you very much. Thank you very much.